stagnation is going to be in our feet. And a lot of people, like majority of people, like you go back 100 years, we were outside for about 80% of our day. Nowadays, we're probably about outside anywhere between like 2 and 6% of our lives. So we're never really discharging because our body does create a charge, and this is our only way. The only way to really like dissipate that charge that we have is getting out and going to ground. So walking in the dirt, walking in the grass, connecting to that earth, getting in the sand, that stuff will actually help charge you up with negative ions, and then you're discharging yourself as well. So the feet get a lot of stagnant energy, a lot of stagnant circulation in it. And I'll always test it out. And normally clients are coming in either just for some like ankle restoration to feel more fortified, or they have issues going on, like where they've broken their tibia or their fibula, they've broken a couple metatarsals, and they might have some plates and screws in here. A lot of times I'll always ask during it, like I'll feel around the area where they did have that surgery. Because of weight and gravity pulling everything down, this is one of the most common areas for actual like implantations from screws, rods, and stuff like that to actually get rejected. So if you feel like something's very pointy and you're like, I'm working around the ankle bone, but I feel like it's like protruding out of the skin a little bit, I would recommend them going to go to their doctor who already did that surgery and ask them to remove the plates or screws because the body is already rejecting it. It doesn't want it in there. And so
Yeah, so I had to do that.
you went and got yours removed because you had something coming to the surface, didn't you? Yeah, and so and same thing happened with my auntie. Like her screws were starting to come to the surface. You can't work on that. You can puncture skin then because it's getting rejected. So then it's like, oh, I can work around the ankle, but I'd rather them go get the stuff removed, that hardware removed, and then after that's healed, we'll go in and remove that excess calcification buildup. A lot of times you're going to feel tons of crystallization, but the ankle, like I said, has a lot of stagnation in it, so we get the calcification buildup because we don't get a lot of circulation out of it. So we can get bone spurs, bunions. When people are getting plantar fasciitis, it's coming around the actual calcaneus, the heel itself, and that's where people feel like when I'm walking, it's like I'm walking on little shards of glass. That can be broken up, but some of those shards are really rooted into the calcaneus, the heel itself, that if you're not putting, because the feet carry you around, you can do a lot of damage on these all day, that they can handle also quite a bit of pressure. So you got to build up the resistance with your elbow to get that deep. So we have 4 main positions. We're going to have the top of the foot, we got either sides of the foot, and then we have the base, the bottom of the foot. I'm always going to begin about 2 to 3 inches above, just on the shin. So technically we are starting on the shin, and we're going to scale off the tibia and the fibula, and then right where the bend is, you can feel like it's softer tissue, but there's a lot of tendons and ligaments in here. This is called our talus. Our talus, and remember, before muscle bellies get like atrophied and dehydrated, because there's most of our water is stored within our muscles, our tendons and ligaments will start to dehydrate. So they get really short in here. And then when those tendons and ligaments start to dehydrate, they start pulling on the bones. So things can start to shift a little bit in the feet. That's why over time people's toes will start to in-turn or kind of curve over. You can get a lot of different things kind of happening. So the talus is generally like a large focus point while I'm doing the foot. I'm going to start 2 to 3 inches above, and I'm going to scale down the tibia and the fibula. I'm going to work directly into the talus, and I'm going to work just the side of the medial malleolus and the lateral malleolus. I'm not going to work around the ankle bones just yet, but I want to try to get off a little bit on those sides. Once I've done that, so then we have tarsals, and then we got metatarsals. And think of tarsals for toes, carpals for carpal tunnel syndrome. So carpals are in the hands, tarsals are in the toes. I have my metatarsals down here, and you can see, like when I separate those toes, you can see this pathway where I'm kind of sitting in between. But as I come up, getting closer to the talus, the bones are closer together, and they separate down towards the toes. So when I begin on the tarsal area, you're kind of covering the whole top of the foot. You're not going to be like on each individual tarsal. But as I start following down the foot, my elbow will fall into the groove to where I can clean in between the metatarsals. And I'm going to clean down each individual pathway of those toes. And when I'm doing that, this is actually a large meridian to help drain that lymph area. So sometimes when you're doing the feet, you'll start to feel they're sweating a lot, and their body's kind of temperature is kind of raising because they're now flushing that lymph a little bit. We've stimulated it. So starting 2 to 3 inches above on the tibia fibula, working down focusing in the talus. Then I start to scale over top of the tarsals, and then I'm allowing my elbow to fit in between the grooves, and I'm going to clean out in between the metatarsals down to the toe, and then I work my way back up. So think of this similar to the ribs. Remember when we came down the rib and back up, and then in between in the intercostal muscles? So now I'm working down in between the metatarsals, and then I scale back up, then I will scale down the next one, back up, next one, back up, and so forth until I finish each individual metatarsal. Once I've done that, it makes a lot more sense when we're doing the hands, because we call it like hot dog bun technique, because my hand could be like a hot dog bun and the finger would be the hot dog to work each individual phalange. But if I want to work the toes, I'm not really getting like that bun because most people don't have that large of toes. So you're going to like hook with one finger or two under the toe to isolate and work on each individual phalange, which are going to be the toes. Once I've done that from face to face, I'm going to flip myself around and I'm going to finish the top portion of the foot from face to feet. So I pulled everything down and then I'm going to pull everything up. Then we are going to go to the medial side. I'm going to rotate it out, but I want to support her knee with a bolster so there's no weight pulling on that. So I'm just going to tuck that bolster in nice and like so. And technically I'm doing this just because I'm talking to you.